Hello everyone, this is drcjtank and today we will discuss about the hospital and its organization. In this chapter we will cover about the definition and classification in the subject pharmacy practice BP 703 TT. So here we will discuss about the hospital and its organization. This is the very first chapter of the pharmacy practice subject. Here we will discuss about the definition and classification of the hospital. So first of all, the definition of the hospital. We can say the hospital is a complex organization and an institute which provide the health to people through complicated but specialized scientific equipments. Here the doctors or the team, or we can say the trained staff, they are using the scientific equipment and a team of trained staff that educated in the problem of modern medical sciences. So as a definition we can say हॉस्पिटल एक कॉम्प्लेक्स ऑर्गेनाइजेशन है और ऑल्सो वी कैन से दैट इज ऑल्सो वन ऑफ द इंस्टीट्यूट. यहाँ पे ट्रेन स्टाफ जो कि एजुकेटेड है और ट्रेंड है, दे विल गिव क्योर और दे विल गिव द हेल्थ, दे विल सॉल्व द हेल्थ रिलेटेड इश्यू ऑफ द पेशेंट. सो हॉस्पिटल वी कैन से इट इज वन टाइप ऑफ कॉम्प्लेक्स ऑर्गेनाइजेशन. They are institutions which deliver the healthcare. Here the word that comes, that is the healthcare. Hospital specially they are designed or specially they are organized to give the treatment about the healthcare issues. So this is about the basic, this is the definition of a hospital. Then also we can say the providing care to actually ill patient that require constant monitoring by skilled nurses, physicians, pharmacists and doctors. So यहाँ पे जो भी टीम है, नर्स, फिजिशियन, फार्मासिस्ट एंड डॉक्टर्स, ये सभी की टीम मिलकर they will give the treatment or they are providing care to the ill patient that require constant monitoring. See, in another terminology we can use the clinics or consulting house. यहाँ पे क्लिनिक्स और कंसल्टिंग हाउस दैट इज लिटिल बिट डिफरेंट कंपेयर टू द हॉस्पिटल्स. क्लिनिक्स और कंसल्टिंग हाउस हम यूज कर सकते हैं यहाँ पे स्पेशली फॉर जहाँ पे डॉक्टर्स विथ पैरामेडिकल स्टाफ, जहाँ पे बहुत ही कम डॉक्टर हो और विथ सम पैरामेडिकल स्टाफ. सो फॉर दिस पर्पज वी कैन यूज द वर्ड दैट इज द क्लिनिक्स और कंसल्टिंग हाउस. So this is the definition or we can say the understanding about the hospitals. Nowadays in India we are considering the hospital, they plays very much important role because the World Health Organizations, according to the data of World Health Organization, at least half the world population still misses out on essential health services. तो यहाँ पे क्या है, हॉस्पिटल सर्विस बहुत ही बेसिक सर्विस जो कि क्लिनिक के माध्यम से भी दिए जाती है. क्लिनिक्स के ऊपर वहाँ पे बेसिक जो भी हेल्थ केयर सर्विसेज है दैट विल बी प्रोवाइडेड बाय द गवर्नमेंट. इंडिया में भी ऐसा है कि यहाँ पे पीएचसी सेंटर, सीएचसी सेंटर जो भी है, तो वहाँ से बेसिक हेल्थ सर्विसेज दैट विल बी प्रोवाइडेड टू द पर्सन. सो हॉस्पिटल दैट इज वेरी मच इम्पोर्टेंट रोल for the overall development of the any state. So अभी भी भारत में आज के दिनों में भी अभी भी बहुत ही कम मेडिकल कम हॉस्पिटल्स है और ज़्यादा से ज़्यादा अभी तक हॉस्पिटलों की ज़रूरत है कि जिससे ओवरऑल डेवलपमेंट हो सकता है पर्सन का. So these are the basic concept of the World Health Organization. Then hospital, we can say hospital that is the city within a city. How that we can say here that within its four wall it has an operation theater or they have the hotel which is in the shape of the patient room. They are having the dormitory for the student nurses. residents and interns. That means कोई हॉस्पिटल को अगर हम कंसीडर करें तो यहाँ पे सबसे पहली चीज होनी चाहिए, दैट इज द ऑपरेशन थिएटर. देन दे शुड हैव द स्पेशल रूम फॉर द पेशेंट. देन द डॉर्मेट्री वहाँ पे होना चाहिए स्पेशली, क्योंकि यहाँ पे स्टूडेंट नर्सिस रहेगी और रेसिडेंट डॉक्टर भी रहते होंगे, और इंटर्न्स जो कि स्टूडेंट जो भी इंटर्नशिप कर रहे हो तो उनके लिए देयर शुड बी द फैसिलिटी ऑफ द डॉर्मेट्री. देन देयर शुड बी अ स्कूल ऑफ ट्रेनिंग ऑफ नर्सिस, टेक्नीशियन एंड डाइटिशियन. ट्रेनिंग के लिए स्कूल भी होना चाहिए, दैट मीन्स द कॉलेज दैट शुड बी अटैच विद द हॉस्पिटल. देन देयर शुड बी द फैसिलिटीज ऑफ द लेबोरेटरीज. Then a pharmacy, very important. Then food vending operation. Food vending operation, that means यहाँ पे हम कंसीडर कर सकते हैं अगर वहाँ पे कैंटीन हो, कैंटीन फैसिलिटीज that should be provided in the hospital. Also in some condition if there is a resident doctors and interns, so in that condition there should be the facility of the mess also. Then laundry and linen services, delivery services, a post office that should be within the hospital, a massive internal and external communication system, blood bank बहुत ही जरूरी है, accounting and credit services, accounting और credit के लिए that means we can consider the bank, a public relationship department specially that is required if in case of any type of dispute that happens, so in that or in case of any type of grievance, a public relationship department that is very much important. Then a motor services, that is also important, and always security patrols in the hospital. So if we are considering this all the things together at one place, then obviously we can say hospital, they are the city within a city. That means all the facility, if we are considering one particular city, then the city, it should have all the facility, the same facility that should be within the hospital. So for that we can say hospital, they are a city within a city. Then classification of hospital on the basis of service offered by the hospital, we can say they are divided into a three different category. First one, that is the primary care hospital. Second one, secondary care hospital, and tertiary care hospital. So we will go, or we will understand this one by one. First one, primary care hospital. This is usually a multidisciplinary hospital providing overall medical and also the small surgical services. It also provides one nursing unit, 24 बेड्स होने चाहिए प्राइमरी केयर सेंटर में, एक कैजुअलिटी एंड इमरजेंसी डिपार्टमेंट. देन इन एडिशन इट ऑल्सो प्रोवाइड अ बेसिक डायग्नोस्टिक सर्विसेज, अ क्लिनिकल लेबोरेटरी एंड एक्सरे यूनिट एंड अ गुड फर्स्ट एड किट. सो दिस ऑल द थिंग्स दैट शुड बी प्रेजेंट इन अ प्राइमरी केयर हॉस्पिटल. प्राइमरी हेल्थ सेंटर अगर हम विलेजेस में कंसीडर करें प्राइमरी हेल्थ सेंटर, तो अभी भी ये सब फैसिलिटी आज के दिनों में भी विलेजेस के अंदर नहीं है. तो इंडिया एक ऐसी कंट्री है कि जहाँ पे बहुत सारा डेवलपमेंट अभी बाकी है, कि विलेजेस के अंदर अगर हम प्राइमरी केयर सेंटर कंसीडर करें तो वहाँ पे डायग्नोसिस के लिए एक अलग लेबोरेटरी और उसके लिए एक अलग डिपार्टमेंट रहता है, जो कि सभी हॉस्पिटल और प्राइमरी केयर सेंटर में इंक्लूडेड नहीं होता है. सो these are the things that should be present in a primary care hospital. Then secondary care hospital, a multidisciplinary hospital which provides oral medical, surgical, obstetric, pediatric and orthopedic services and medical research facility. So this all the facility that should be present in a particular place or in a secondary care hospital. Obstetric, here the obstetric, that means related to the childbirth. Then it also offers tertiary care services like ICU, that means intensive care unit, or one or two specialty service like gastrointestinal surgery on a limited basis. For example, they should have the facility to remove the gallbladder stone and also for the removal of appendix. So such type of facility that should be present in a secondary care hospital. Then it also provides at least 2 nursing unit, which includes 24 beds and a casualty and emergency ward and resuscitative service. See, resuscitative service that is also plays the important role in case of secondary care hospital. So actually this facility it provides this service it provides the facility of resuscitation, the process of correcting the physiological disorder. Resuscitative, that means the process of correcting physiological disorder in acutely ill patient. That means in lack of breathing or in case of heartbeat, resuscitative service that should be the such type of facility that should also be present in a secondary care hospitals. Then it has advanced diagnostic service. There should be the high-tech pathological lab, specialized radiology and sonography department. Then they should have independent administrative unit. Administration of such a big hospital, that is also important. So they should have the independent administrative unit. Then it also provides assistance to non-institutional healthcare activity to the community, such as health checkup camps. Secondary care hospital, they should organize the health checkup camps. National health services, they should play the role in health services like polio dose administration. अभी जो हमारे गवर्नमेंट है यहाँ पे इंडिया में तो पोलियो के लिए आज भी लोग जो भी CSC सेंटर PSC सेंटर में नर्सेस वगैरह काम करते हैं तो होम टू होम यहाँ पे जाकर ये पोलियो डोज एडमिनिस्ट्रेशन किए जाते हैं. तो that means secondary care hospital they should provide or they should be involved in such type of activity where the dose administration that is required to particular person or if requires then they should go home to home. That means at each and every home they should go and they should deliver the product like this or they should deliver the dose of particular condition. So this facility that should be with the secondary care hospital. Then WHO special camp, WHO World Health Organization, again they have given the special condition, for example in case of HIV or AIDS diagnosis, then the cancer diagnosis camp etc. that should be done by the secondary care hospital. Then it should have also the disaster management plant, for example in case of condition of the earthquake, then in condition of the floods, then in case of forest fire, rail accident. So in such a certain condition there should be the facility or there should be some management plant with the management plan for the such type of condition on a large scale. The facility that should be on a large scale. So in such certain condition of the floods, then if there is any patient, there will be the lots of patient. There might happen that, for example, rail accident is there. So the lots of patient will be there. So in such a condition, the secondary care hospital they should have the enough facilities. Then tertiary care hospital. So this hospital they should have all the services that is offered by the secondary care hospitals. And in addition, it should have 1 or 2 specialties like cardiac care, GI tract surgeries, eye surgeries and obstetric surgeries, etc. Then in case of single or 2 specialties, it may also provide any other selected secondary or limited tertiary care services. So it should have certain specialties, specialty service that should be provided by the tertiary care hospital. Then it should have 2 or 3 nursing homes. They should have the facility in between 24 to 50 beds, an advanced diagnostic service that is equipped with the latest technology, and also highly advanced clinical laboratory and sonography and Doppler studies department. So here the tertiary care hospital they should have the diagnostic service, that is very much important. Diagnosis service equipment that should be, and also they should have the equipment, such equipment with the latest technology, and also they should have the facility of the sonography and Doppler studies department. Here the new word it comes, that is the Doppler studies department. Doppler studies department, this Doppler ultrasound is a special type of ultrasound which is used to look at the blood flow. Here we can determine or we can see the blood flow. A Doppler ultrasound machine has a handheld scanner. One of the scanner is there. See over here in the picture you can see one of the scanner is there, which is connected to a computer. The scanner that is connected with the computer, it uses the sound waves to make picture of the blood flow in your major arteries and veins. A regular ultrasound uses sound waves to produce the image but can't show the blood flow. But here in case of Doppler studies or with the help of Doppler ultrasound, we can determine the blood flow in case of arteries and veins. So such type of latest instrument, the facility of latest instruments that should be present with the tertiary care hospital. Then multi-speciality screening in its OPD. It should have tie-ups with the teaching hospital and should be able to take interns for their course of study. Then it should be reachable by all the primary and secondary care hospital within 90 minutes of an ambulance ride. Then it should have 2 or 3 of its own ambulance, with at least one having the equipment to tackle the emergency condition में अगर कभी पेशेंट को ट्रांसफर करना हो तो they should have their own ambulance, especially in case if we are considering बहुत सारे केस में यहाँ पे भी जूनागढ़ में भी आजकल आज फैसिलिटी इतनी नहीं है, तो बहुत सारी कंडीशन में क्या होता है कि यहाँ से रिफर करते हैं पेशेंट को राजकोट के अंदर. सो इन दैट सर्टेन कंडीशन there should be the ambulance that should be present with the hospital, tertiary care hospital. अगर यहाँ पे हम जूनागढ़ सिटी में कंसीडर करें तो गवर्नमेंट हॉस्पिटल जो भी GMERS हॉस्पिटल है वहाँ पे tertiary care hospital that we can consider, that is a tertiary care hospital. Then Agira multi speciality hospital, that is also we can say that is a tertiary care hospital. Chikhalya hospital, Dr. Chikhalya Hospital, that is also a multi-speciality. Then Makadia multi-speciality hospital. So over here there should be the there should have their own ambulance. So if in certain condition the patient that should be shifted from one hospital to another, then he will reach to other hospital within a time. So tertiary care hospital, in this there should be such type of facilities. Then classification of hospital based on clinical and non-clinical basis. Here first we will consider about the clinical basis of classification. Clinical, that means treatment of disease in human beings. Different type of diseases need different modes and also the means of the treatment. Accordingly, the hospital there should be divided in 3 different types. Here we are considering on the basis of clinical, we are considering the classification on the basis of clinical base. So here 3 types. First one that we can say, that is the maternity hospital. Another one that is the surgery, that means the surgical hospital, and third one that is the medicine. First one we will discuss over here, the maternity hospital. Here the specialized to provide obstetric services, that means dealing with the childbirth and gynecological, that means related to female reproductive system services, along with the antenatal and neonatal care. Antenatal care, that means we can say during the pregnancy in some certain condition the care should be taken, that is known as antenatal, and neonatal, that means in specially condition of newborn child the facilities should be provided by the hospital, that is known as a neonatal. See, in this condition there should be the ICU that should be present in a maternity hospital. That means in certain condition, if the patient requires the intensive care unit, then the facility that should be present with the hospital, that is known as a neonatal, we can say the neonatal care. Then surgery, or we can say the surgical hospital. They are specialized to perform the surgical operation with this operation theater and surgeon. Here we can divide them. Gynecological surgery portion, if we are considering, then we can say the gynecological, that means related to female reproductive system. This is usually attached with the maternity hospital. Then orthopedic, that means surgery related to bone fractures. Then otolaryngological, that means we can say ENT, that means related to ear, nose and throat surgery. So this all comes under the surgery, we can say the surgical hospital. This could be the individual hospital. In our city also there is a individual gynecological, orthopedic, ENT doctors are there. So we are considering the different classification on the basis of surgery. Again there is a different on the basis of disease, we can say there are different hospital, gynecological, orthopedic and ENT specialist. Then cardiothoracic, that is related to the surgery of heart and lungs. Then general surgery, for example surgery of any kind. Then neurological, having the facility for surgery of brain and spinal cord. Then kidney hospital, it is involved in the kidney transplantation and blood or peritoneal dialysis services. So such type of kidney hospital which should have the facility of transplantation and also for the dialysis services. Here the one different word, that is the peritoneal dialysis services. We will see what is the peritoneal dialysis service. See, during the peritoneal dialysis, a cleansing fluid that flow through a tube, that means the catheter, into the part of your abdomen. See, special peritoneal dialysis service that is required in case of kidney failure. See, if the kidney it doesn't work properly, so in this condition the dialysis that is required. So here we need to remove the toxins from the abdomen. So in this particular condition we should have one of the dialysis solution that should be inserted through the catheter into the peritoneum or into the abdomen. So here the lining of the abdomen or peritoneum, the lining of the abdomen or the peritoneum, they will act as a filter and it will remove the waste product from your blood. Now after a set period of time, see, after the certain condition, once we have inserted this dialysis solution into the cavity, then afterwards we can remove this catheter and we can remove this bag and patient can move anywhere in this condition. Then after the certain set of time, or we can say the certain period, once the whatever the liquid that is saturated with the toxins, so at that condition the liquid, the dialysis solution, it should be removed. So in this condition again the catheter will be inserted and then afterwards the fluid will be removed from the abdomen and it will be discarded. So by this condition, certainly it is used to remove the excess fluid that is present, then to correct the electrolyte problem and also remove the toxin in this with the kidney failure. If the patient they are having the kidney failure, then such type of peritoneal dialysis service that is required. Then the third classification of clinical, that is the medicine. Here a surgeon can advise about the treatment with the drugs and physician can perform the surgery if that is required. Then over here we can say the general hospital, where what is called family physician that treat or advise the patient. Then pediatric hospital, that means where special care for the children that is taken. Then communicable disease hospital, it should have the adequate space to prevent the spread of the infectious disease and takes the care of patient with such a disease. Recently in this COVID situation also, there was a big role of communicable disease hospitals, especially the patient, they will go to the CHC centers and PSC center in this condition. So also here also there was a very unique role of the doctors and pharmacists and nurses about the spread of this disease. They should give the proper guidance to the patient about the coronavirus or about the corona disease. So communicable disease hospital that comes under the medicine. Then mental hospital or psychiatric disease hospital, it has the facility to house, treat and rehabilitate the patient with the mental illness. Then drug addiction rehabilitation hospital, which attempts to make the patient dedicated from the narcotics. In certain condition there is a addiction of particular, then there should be the drug addiction rehabilitation hospitals. Then for a dental care, there should be the dental hospital. Well, the care and treatment is done for the disease of teeth, and we can say the cancer hospital. So this all the hospitals that comes under the medicine. Here the first, the medicine that is provided by the experts, by the expert doctors, and if the surgery is required, then and then only the surgery that is initiated. Then different hospital of different specialty, we can say the skin and venereal disease hospital, kidney hospital, eye hospital, family planning hospital, cosmetic surgery hospital, and diabetes and obesity hospital. So this all that comes under the classification of medicines. Then non-clinical basis of classification. Yet we have seen about the clinical basis. Now the non-clinical basis of classification. Here first one we can say the ownership and control basis of classification. See, who is going to control whether it is from the government side or if it is on a private run, then on the basis of the ownership, और यहाँ पे कौन कंट्रोल कर रहा है हॉस्पिटल को या फिर ओनरशिप के माध्यम से वी कैन डिवाइड देम. फॉर एग्जांपल फर्स्ट वन दैट इज द गवर्नमेंट हॉस्पिटल. Government hospital, here also the public health services service center, that means PHC center, and or civil hospital. So here the All India Institute, some of the examples are there. All India Institute of Medical Sciences, New Delhi. Then Postgraduate Institute of Medical Education and Research, Chandigarh. Government hospital of different cities, University of Health Center, University Health Center or Primary Health Center. This all they will come under the government hospitals. All these hospitals may be associated with the teaching institution like medical college. Here also in Junagadh we have GMERS Medical College. GMERS that is the hospital, and also we can say it is attached with the institution, that means the teaching institution that is attached with the hospital. Then another one government hospital or the government run on the basis of ownership, we can say that is the military hospital for the army, air force or navy personnel. Then non-government hospital. Non-government hospital, that is especially we can say the private run hospital. First we can say the private run, and especially they are for a profit. For example, Apollo Hospital, then we can say the Escort Hospital, Sterling Hospital, Wockhardt Hospital, then Sidus, they are also having their private run hospital. So general purpose, we can say that is for a profit purpose. Then charitable trust hospital. Some hospital they are running, these are not for a profit. They are charitable trust hospital. For example, Ramakrishna Mission Hospital at Kolkata, Christian Missionary Hospital at Vellore, and Munjibai Hospital, Nadiyad. Some of the example, these are some of the example for the charitable trust hospital. They are doing the operation or they are doing the surgery at very cheaper cost. Here the profit that is not in a center. So on the basis of non-government hospital, we can divide them private run hospital as well as charitable trust hospitals. Then system of medicine, basis of classification. India में यहाँ पे that we are not only using allopathy system, We are also very much familiar with the Ayurvedic services and also homeopathic services. रिसेंटली अगेन मैं आपको बताऊंगा कि कोरोना सिचुएशन में भी आयुष मंत्रालय उन्होंने बहुत सारे नोटिफिकेशन जारी किया था कि जिससे इम्यूनिटी बढ़ाने के लिए बहुत सारे आयुर्वेदिक मेडिसिन दैट वी कैन टेक. सो यहाँ पे ओनली वी कैन नॉट से ऑन द बेसिस ऑफ एलोपैथी वी आर नॉट कंसिडरिंग ओनली एलोपैथी सिस्टम, बट इन इंडिया we are considering about the different Ayurvedic herbal product also. See, now there is also a spread of such type of product, or we can say one of the market that is in developing condition, that is of Ayurvedic, or also that is a herbal product that is also popular nowadays in this corona situation. So on the basis of system of medicine, we can say there is a homeopathic hospital, Ayurvedic hospital, Unani hospital, and naturopathy hospital. This hospital again may be sub-classified according to the clinical basis. Again, we can say on the basis of ownership, whether it is run by the government or run by the private institute. Then administrative control basis of classification as mentioned above. That means we have mentioned in a previous slides. Accordingly, we can again classify the Ayurvedic hospital and as well as in case of homeopathic hospitals. Then miscellaneous basis of classification. Here we consider about on the basis of accreditation, whether the accreditation that is whether the particular hospital that is accredited or not. So on the basis of that, we can say accredited hospital specific standard and approved by the accreditation committee, and non-accredited hospital on the basis of the size of or the number of beds that is present in the hospital. For example, small hospital they have less than 100 beds, medium hospital 100 to 499 beds, and larger hospital we can say 500 or more beds. Some hospitals, Sterling, Wockhardt, Zydus, they are having the such type of facilities. So these are the classification on the basis of miscellaneous basis. So overall in this video we have considered about the first one, definition hospital, what is hospital, then the primary care hospital, secondary care hospital, and tertiary care hospital, and we have classified the hospital on the clinical basis of classification, and we have classified the hospital on a non-clinical basis of classification. So over here in this video we have considered about the hospital and its organization, and we have considered this above point, or we have considered these points. So in next lecture we will consider about the organization, structure of hospital, and we will study about the medical staff that is involved in the hospital and their function. So thank you for watching this video.